Congresswoman, thank you so much for making time for this conversation.
Listen, Ady, I'd do anything in the world just to be able to see you. Wish I could hug you, and you look great. How do you feel?
I am feeling good despite the crazy world.
Yeah, I guess this is a real turning point in the history, really, of this country and the world.
I would love to start this conversation at the beginning. Please tell me about your youth and how you became a political person.
One thing I need to start with is my birth, believe it or not. My mother needed a C-section. I was born and raised in El Paso, Texas, and she went to the hospital and they wouldn't let her in because she was Black. But my grandmother finally got her in because my grandmother looked like she was white because her father was Irish. But once she got in, they would not attend to her. They did not give her any medical care at all. That's why healthcare is so important for me. Make sure everybody has access to affordable, accessible, quality healthcare, because they wouldn't provide my mother with any healthcare, with any medical attention. So it was too late for a C-section. They didn't know what to do, so they finally drug her into the emergency room, and they delivered me, Ady. They delivered me using forceps, so they pulled me out, and I almost didn't get here. I almost didn't breathe. My mother almost died. So that's the beginning of my childhood, is fighting to just live.
That is a harrowing tale about your birth, but it was of course far too common in the Jim Crow South. And still too common today, still. Many Americans are just now learning about the history of the Black Panther movement and the intersectional struggle for freedom they led through the lens of Black liberation. You have incredible insider experience here. The Panthers endorsed Shirley Chisholm's historic presidential campaign in 1972, which you worked on.
But I just did what I had to do because I believed in it so strongly.
And then in 1973, you worked on Bobby Seale's campaign for mayor of Oakland. Can you tell us about this experience?
Well, the Black Panther Party was an organization. It was a political organization, but it was also a service organization. And the Black Panther Party believed that for Black people and poor people and people of color, because it was a coalition party and we had many allies, that we had to address structural racism. Most people thought that was radical. Now you hear people saying structural racism, systemic racism as a result of the brutal murders of Black and brown people, especially Mr. Floyd. Now systemic racism is okay to talk about. But then in the day, But the Black Panther Party did, and they talked about we could not tinker around the edges if there was going to be true equality. We had to deal with the structures in the society to make them equitable for everyone. And so they developed 10-point programs. They started one of the first community clinics, the George Jackson Free Medical Center. I actually helped with the breakfast program, with the survival rallies, because people still in my district in Oakland, there are many low-income people, low-wealth people who live below the poverty line. So we bagged groceries. I knew Huey Newton and Bobby Seale very well. I was the one who convinced the Black Panther Party to engage in voter registration efforts and support Shirley Chisholm. And it was really an honor to have had that part of my life connected to the Black Panther Party, not as a member, but as a community worker.
Well, thank you so much for your long and principled work. You have a history of taking on challenges as an elected official that others have not, including advocating for health care in the queer community, especially during the HIV/AIDS pandemic. Can you tell me about your work during that era? What drove you and how you approached those struggles?
Well, I approached those struggles the same as I approached the struggles for racial justice. During the HIV/AIDS pandemic, a mentor of mine, Maudel Shirek, she called me up, this was in late 80s, told me I better get down to this rally. And I said, what are you talking about? And I got down there and it was a rally with ACT UP. I listened to the speeches. I said, oh yes, I'm gonna act up too, because there is no way this country should be, first of all, turning its back on this deadly virus. But also, when you look at who it's affecting and when you look at how it's affecting the LGBT community and no one's speaking out, on their behalf, I'm going to join the struggle. I'm going to act up to. And so for me, it's just natural. I couldn't sleep at night if I weren't fighting for what was right for everybody. And if the LGBTQ community needs me, and I'm certainly going to follow their lead on any issue, I'm going to be right there. And it's like I have no option.
Another marginalized community, the disability community, is fighting right now for $400 billion in funding for home and community care. It would be a transformational investment that would allow disabled Americans to stay in their own homes. Home health care is literally keeping me alive. What can the disability community do to win this investment?
I'm so glad you're able to be at home. I mean, this makes a whole difference in everyone's lives who could end up being in a nursing home. And thank God you had the resources and the support to do that. You know, my sister has multiple sclerosis. I don't know if I've told you that. And she, needs caregivers. She's at home. But because she has good insurance, she's able to live a life at home and do quite well. And she tells me, and like my mother told me, each and every day, you better fight so everybody can have the type of care that we have. And so what we can do is get in touch with your members of Congress, tell the Republican or Democrats, tell them to support those resources and any legislation and funding priorities that address the needs of the disabled, especially long-term care and caregiving, and make sure that caregivers are trained, they have the money for training, good wages and good benefits. That is just so important.
You have long supported single-payer Medicare for all. Unfortunately, we don't have the votes we need to pass it now. Instead, as an interim step, progressives are pushing to lower the Medicare eligibility age and improve the program so it covers vision, dental, and hearing care. Do you think we can win those reforms this Congress?
I'm cautiously optimistic that we can win those reforms, which are extremely important. But we've got to be moving toward single payer and Medicare for all. Again, it's a marathon. We're going to get there. I'm very optimistic that we can at least get this done, this Congress, in terms of adding the benefits, for Medicare.
Congresswoman, you have also worked to combat systemic racism in our healthcare system. How does that inequality manifest itself in your district, and what do you think we should be doing about it?
Racial inequities in the healthcare system are seen very vividly, unfortunately, in my district. Take right now the COVID pandemic. Who got the virus and who died from it, disproportionate to the population. It was African Americans, it was Latinos and Asian Pacific Americans and Native Americans, people of color. And why? Not just because we're sicker. I mean, the underlying conditions are a result of the neglect and the racism in the healthcare system historically. And so we've got to see this holistically in terms of racial justice, and not just address the healthcare system per se and access, but we have to address the social determinants of healthcare, which means poverty, employment, housing, clean air, climate. It means all of those social issues that impact our health. And that's how we have to approach racial equity and racial justice as it relates to healthcare.
Congresswoman, it has been such a privilege and pleasure to see you and hear your stories and feel your power. You are a guiding light for so many of us around the country, and it is an honor to be in these struggles for justice by your side.
For me to sit with you and talk with you about this has been truly an honor and a pleasure for me. And like I said, it gave me a chance to see you and just to say I miss you and I love you and I'll see you soon.
I promise that I will come see you on Capitol Hill soon, and we will transform this country together. You have my love and best wishes.
Thank you so much. Soon and very soon.